When people talk about aging, they worry about the heart, the brain, maybe the kidneys. But few realize that the first quiet signs of decline often begin in the legs. Yes, your legs. The part of your body that carried you through every season of life may also be the first place where death quietly begins to knock. Not suddenly, not dramatically, but silently, through weakness, numbness, and slowed circulation. In this powerful and eye-opening video, we'll uncover 3 hidden signs in your legs that could signal serious risk after 65, and more importantly, how to catch them early and reclaim strength, stability, and life. Because aging doesn't begin in your wrinkles, it begins in your walk. Sign number 1, loss of leg strength and muscle mass, sarcopenia. You may not feel it happen, it doesn't hurt, it doesn't make noise, but one day you notice something's off. You need 2 hands to push up from a chair. Climbing stairs takes more effort than you remember. Your legs feel thinner, weaker, almost like they're shrinking. And then you catch yourself saying things like, I just don't have the strength I used to. My legs get tired so fast these days. I feel wobbly when I get up too quickly. What you may be feeling is sarcopenia, the medical term for age-related muscle loss. And it's not just a normal part of aging. It's a powerful predictor of early death, disability, and sudden falls. Sarcopenia is where death in the legs begins, long before any diagnosis is made. What is sarcopenia? Sarcopenia refers to the progressive loss of muscle mass, strength, and function that begins around age 60 and accelerates after 70 if left unaddressed. It especially affects the legs first for 2 reasons. They carry your weight all day. They're used less often as mobility decreases. Without regular stimulation and proper nutrition, your muscles slowly waste away, becoming smaller, weaker, and less able to support your frame. This is not about aesthetics or vanity. This is about your ability to get up from bed, walk to the bathroom safely, climb a few stairs without collapsing, catch yourself if you trip. When leg strength declines, independence slips quietly with it. In medical research, leg weakness is one of the earliest warning signs of frailty syndrome, immobility, increased fall risk, poor recovery after surgery, and even higher all-cause mortality. In fact, some hospitals now use a simple test to measure leg strength, like how long it takes you to rise from a chair 5 times, as a predictor of who may be at highest risk of death within the next 5 years. It's not your heart, it's not your memory, it's your legs. Here are subtle signs you may be losing leg strength, even without realizing it. You avoid stairs and hills more often. You feel unsteady getting out of a low chair. You need support, walls, cane furniture to walk longer distances. You notice muscle shrinking or skin sagging around your thighs. You walk slower than you used to. You feel tired or heavy after standing for short periods. If you're noticing 2 or more of these signs, it may be time to take action. What you can do to rebuild leg strength. The good news is this: muscle loss is not permanent. With the right steps, you can rebuild strength, even in your 70s, 80s, and beyond. 1. Gentle leg exercises. Start small, consistently. Sit to stand 5 to 10 times a day from a sturdy chair, marching in place while holding a counter or chair back, heel raises, and side leg lifts for balance and ankle strength. If possible, short, regular walks with support. 2. Prioritize protein in every meal. Muscle cannot rebuild without fuel. Include eggs, tofu, fish, chicken, beans, lentils, and low-fat dairy. Protein shakes or smoothies if appetite is low. Aim for at least 1.0 or 1.2 grams protein per kg of body weight. Consult your doctor or dietitian. 3. Stay hydrated. Dehydration reduces muscle function. Aim for 6 to 8 cups of fluid per day: water, herbal tea, broth, or smoothies. 4. Talk to your doctor. Ask for a muscle strength screening. A physiotherapist or geriatric specialist can help build a custom plan that's safe for you. Your legs are not betraying you. They're whispering, "Don't forget me. Feed me, move me, use me." Because the truth is, death may quietly begin in the legs, but so can renewal, strength, and life. One step, one meal, one gentle movement at a time. Sign number 2, poor circulation in the lower legs, peripheral artery disease. You may not feel it at first, just a little tightness in your calf after a walk, a sense that your feet are colder than usual, maybe a small scratch on your shin that takes longer to heal. You brush it off. "I'm just getting older. My legs have always been cold. It's nothing serious." But quietly, inside your body, something deeper may be happening. That discomfort, that chill, that slow healing wound. It could be a warning sign of peripheral artery disease, PAD, one of the most underdiagnosed but dangerous conditions affecting seniors over 65. And it starts silently in your legs. What is PID and why does it matter? Peripheral artery disease is when the blood vessels that supply your legs become narrowed or blocked, often due to plaque buildup, atherosclerosis. This means less oxygen rich blood gets to your lower limbs, less nourishment, less repair, less life. And because it starts in your legs, PAD often shows up there before anywhere else. It's not just about cold feet, it's about what your legs are trying to tell you about your heart and circulation. Left unchecked, PAD increases your risk of heart attack, stroke, amputation, sudden death. That's why doctors often say the legs are the canary in the coal mine. Here are early signs most people ignore, but doctors watch closely. Cold or numb feet, especially at night. Leg cramps during walking, relieved by rest, called claudication. Skin discoloration, reddish, purple, or bluish tones. Shiny skin with loss of leg hair. Sores or wounds on feet, legs that heal slowly. Weak pulses in the ankles or feet, tingling or pins and needles feeling in the toes. Many seniors think this is just part of aging, but these symptoms are red flags. Many older adults don't mention leg discomfort to their doctor, or they downplay it, or they assume it's just arthritis. But PAD is not joint pain. It's a circulatory emergency in slow motion. And because the early symptoms seem mild or intermittent, PAD is often missed until it becomes severe. That's why it's crucial to pay attention now, not later. The good news? PAD and poor circulation can often be managed, even reversed, with simple, consistent steps. One walk daily, but smartly walking increases blood flow and builds collateral circulation. Start small, 5 to 10 minutes, 2 to 3 times a day. If pain starts, rest, then try again. Over time, your legs can grow stronger, not weaker. 2. Check your feet weekly. Look for color changes, cold spots, or wounds. Use a mirror or ask for help. Report anything unusual to your doctor early. 3. Stay warm and comfortable. Wear socks, leg warmers, or heated foot pads. Avoid sitting with legs crossed or standing still too long. Elevate your legs slightly if swelling occurs, but not too high. 4. Eat for better circulation. Omega-3s from fish, walnuts, flaxseed, berries, leafy greens, turmeric, and garlic. Reduce sugar and processed carbs, they damage blood vessels. 5. Stop smoking. Even if it's been years, smoking is the #1 risk factor for PID. Even past smoking raises risk. Quitting still helps. 6. Talk to your doctor about a simple ankle brachial index (ABI) test. It's painless, quick, and can detect PID early. If diagnosed, your doctor may prescribe medication or lifestyle guidance to prevent worsening. Your legs carry your weight, your memories, your entire journey. When blood no longer flows freely through them, your whole body feels the strain. Death starts in the legs, they say, but so does healing. Every step you take to improve circulation is a step toward life, toward warmth, toward strength, toward staying upright and independent. So don't wait for pain to speak louder. Let your body whisper and let yourself listen. Sign number 3, changes in walking speed, gait, or balance. You may not have noticed it, at least not right away. Maybe it started with shorter steps or a slight hesitation before getting up from a chair. You walk a little slower now, a little more carefully. You instinctively reach for walls, handrails, or furniture as you move through the house. You tell yourself, I'm just being cautious. I don't want to fall. Everyone slows down with age. And while that's true in part, there's something deeper happening, something your legs, brain, and nervous system may be trying to warn you about. When your walking speed, balance, or gait changes, it may not just be aging. It may be a sign that your body is beginning to lose its ability to protect itself. In the medical world, doctors call walking speed the 6th vital sign, right alongside blood pressure, heart rate, and temperature. Why? Because how fast or slow you walk says a lot about your muscle strength, balance control, coordination between brain and body, risk of falling, likelihood of hospitalization or death. In fact, multiple studies have shown seniors who walk significantly slower than average for their age have a much higher risk of mortality, disability, and future decline. Your legs are talking. Your gait is the language. Many of these signs show up subtly, then grow with time. You walk slower, not because you're tired, but because you feel unsteady. You shuffle your feet rather than lifting them. You rely on grabbing nearby furniture to feel safe. You've had a few almost falls or brief losses of balance. You avoid going out because walking feels risky. Your feet don't listen to your brain as quickly as before. You have difficulty turning, especially in tight spaces. These aren't just quirks of aging, they are functional changes that deserve attention. Because once walking becomes a struggle, independence starts slipping away too. After 65, several natural changes affect your ability to walk and stay balanced. Muscle loss, especially in the thighs and glutes, inner ear changes, which affect equilibrium, slower reaction time in the nervous system, vision decline, making it harder to navigate space, chronic conditions, arthritis, diabetes, Parkinson's, etc., medications that cause dizziness or drowsiness. The result, your brain starts to say move, but your legs don't always follow quickly or safely. The goal isn't to walk faster, it's to walk stronger, steadier, and with confidence. 1. Practice balance exercises. Stand behind a chair and lift one leg for 10 seconds. Walk heel to toe across the room like walking a tightrope. Do gentle Tai Chi or yoga designed for seniors. 2. Strengthen your core and hips. Leg lifts, sit to stand from a chair, sidestepping. Use resistance bands or light ankle weights if able. 3. Use assistive devices early, not late. A cane, walker, or walking stick isn't a weakness. It's a smart tool. Choose one that fits your height and gait. Ask a physical therapist to help train you in safe use. 4. Check your footwear. Avoid slippers or loose shoes. Wear supportive, non-slip shoes with good tread. Replace old shoes when the sole wears down. 5. Get a gait assessment from a professional. Physical therapists can spot risky changes in how you walk. They can design a simple plan to rebuild balance, confidence, and safety. Your walk is more than movement, it's freedom, it's independence. It's your body's quiet way of saying, I'm still here. When you walk differently, it's not just your legs speaking, it's your whole system asking for help. So don't wait for a fall. Don't wait until fear keeps you seated. Start now with small steps, gentle strength, and renewed attention. Because death may begin in the legs, but so does every moment of life still waiting to be lived. You've walked through a lifetime of love, loss, effort, and growth. And now your legs, those faithful companions, are telling a quieter story. They don't shout, they don't demand, but they whisper, notice me, I'm changing, I need care. Whether it's muscle loss, poor circulation, or subtle shifts in balance, these signs aren't just about the legs. They're about preserving the life you still have ahead, because death may start in the legs, but so does renewal, so does freedom, so does a future you still deserve to walk into, one strong step at a time. If this video helped you better understand your body, please give it a like. It helps other seniors find this important message. Subscribe to True Senior Wisdom for more healing, practical videos on aging well with strength, clarity, and compassion. And in the comments below, we'd love to hear from you. Have you noticed changes in your legs? What's one step you'll take today to strengthen them with love, not fear? Because the more we talk about what's real, the more we remind each other. Aging is not about slowing down. It's about showing up gently, wisely, and with your whole heart.